So in class you'll go over fluid and electrolytes a lot, but I want to focus on one part that took me a while to grasp, and it's one of the most important things to get about this subject. So for those of you that came to my pathway review session early in May, this is the same thing we talked about there. So in this video I want to focus on connecting the different body systems with fluid balances. So let's start with the heart. When a person is experiencing heart failure, you're going to see a change in fluid balances because the heart cannot pump the blood effectively and the body begins to compensate. The body isn't getting enough oxygenated blood, so the kidneys compensate by increasing the levels of aldosterone, which increases the reabsorption of water and sodium, to keep the blood volume up in hopes of creating more cardiac output for the body. This leads to hypervolemia due to fluid backup and the lack of the fluid being excreted. With right-sided heart failure, you're going to see the fluid back up into the lower extremities, the abdominal area, etc., due to the inability of the right side of the heart to pump fluid through the lungs and into the left side of the heart. For left-sided heart failure, you're going to see the fluid back up into the lungs due to the ventricle's inability to pump the blood to the rest of the body. So you're going to see that pulmonary congestion when you go in to do an assessment. With the renal system, you can see both hypervolemia and hypovolemia. Hypervolemia would be due to impaired filtration due to chronic or acute kidney disease. If fluid can't be filtered out of the body, you will see a backup in the general circulation. Hypovolemia can be caused by excessive diuretic usage, adrenal insufficiency, which would lead to decreased aldosterone, which would cause an increase in the excretion of water and sodium. The GI system is another system that regulates fluid balance, electrolytes, and acid bases in the body. The most common GI losses you will see are diarrhea and vomiting, and if severe enough and long enough, can wreak havoc on your body. With extensive vomiting, you'll see fluid volume deficit and metabolic alkalosis due to the large loss of acids. With extensive diarrhea, the patient is at risk for fluid volume deficit, hypokalemia, and metabolic acidosis. Potassium is mainly excreted via the GI tract as well as bicarbonate. Being able to connect different complications and disorders within different body systems to fluid balances is extremely important. You'll talk about the multitude of implications that fluid imbalances can cause in the body in class and what to do in those situations. Just overall, as nurses, we have to be able to identify these potential complications when tasked with a client with certain disorders, such as heart failure, kidney disease, or any of the above mentioned disorders, so we will be able to treat and hopefully prevent these complications.